Peak Orthopedics has been a group since 2006. We've really focused on cutting-edge techniques over the years with hip and knee replacement. We've spent a lot of time and additional training, honing our skills, in particular the anterior approach for hip replacement, and that's really driven our practice and our growth.
Our mission is really to provide the best service to the patients. We use the latest techniques based on sound scientific principles, and we were really trying to get the best results through the better techniques. We're looking a lot towards minimally invasive options, restoring anatomy, and this is really leading us to fantastic results.
So at Peak Orthopedics and Spine, we have a comprehensive approach to musculoskeletal problems, and we like to evaluate some of the newer technologies to see if they fit with that approach, and recognizing that relying on our experience is important when evaluating the new technologies, so that we're not just always implementing the newest thing because it's new, but rather because it's better for the patient.
I get to take care of a certain part, but the practice itself gets to take care of the whole person. And it's very comforting to know that even though I do elbows, wrists, and hands, that if someone's got a shoulder problem or a neck problem, I can just say, hey, just go see someone within this office that I know will provide a comprehensive, very thorough and complete care for the patient.
Quite honestly, when Dr. Greenhow and I started 8 years ago, we never thought we would grow into a multi-office, multiple surgical center practice where we have essentially cast a huge net over the city and build a group of surgeons with multidisciplinary talents. The advantage of that in an orthopedic group is we feel that we can really address patients' musculoskeletal complaints from head to toe.
I've had a lot of orthopedic surgeries, rotator cuffs. I have another joint replacement in my foot. Have been to a lot of orthopedic offices. I find here at Peak Orthopedics that they are very personable, very professional, and have treated me with the utmost kindness and respect.
Hi, how are you? Good to see you. I was trained on conventional approaches, lateral and posterior, and those work well. People do well, but we felt there was a better way to do it. The anterior approach, when my partner and I trained 7 or 8 years ago, we went to LA. At that time, there were 15 surgeons in the US performing this technique. Now there are probably a dozen surgeons in the greater Denver area. So it is catching on. We started doing it again 7 or 8 years ago. For many years, we were the only two in town doing it. We definitely took a little bit of heat for it, but I think there's a lot of our colleagues that have seen the benefits. Patients are very educated and are demanding it.
Because we believed in the approach and stuck with it, we've been fortunate enough to develop a large group of patients who essentially have spread the word on the benefit of this approach. And really, this has been a patient-driven demand that's created a huge demand across the country.
It's a muscle-sparing approach. No muscles or tendons are cut. There's a lot of advantages for patients. There tends to be a quicker recovery, less pain, more normal return of gait. There are MRI studies done out of Switzerland that show no permanent muscle or tendon changes around the hip.
So I work with a population that has both lateral and posterior approach hip replacements. So I was very pleased to come to see Dr. Greenhow, knowing what an easy approach it was, that there was no restrictions afterwards. Came in, saw Dr. Greenhow, set me up for surgery 6 weeks later, had the surgery at Skyridge Medical Center. Day of surgery, I was up walking. Second day after surgery, I was doing a full flight of stairs. Because they don't cut any of the muscles, I don't have any of the surgical pain that I would have if I had the lateral or the posterior approach. The other thing is there are no restrictions as far as what I am able to do, where my patients have very severe restrictions on what they're able to do. I can probably go back to work within a week now, which is 3 weeks post-surgery, where my patients are still under major restrictions. I will be able to do any physical activity that I want within 6 weeks. So, no restrictions, back to work, no economic downtime.
Hey Ashley.
Hello.
How are you?
Good.
Good. How's your knee doing?
It's all right.
One of the growing segments of the population that we're seeing are people in their middle years, in their 40s, 50s, and 60s, who have what I would call isolated 1 or 2 compartment disease of their knee. Modern technology and some new techniques that we use regularly will allow us to see those patients and actually selectively replace the disease portion of their knee. The advantage for patients is if you don't have to replace the entire knee joint, why would you? I tell patients all the time that it's less invasive. We're not going to cut out the bone, cartilage, and tissue that is still quite healthy. We will selectively replace what is diseased, which is much better for that patient. So when we assess patients with these knee problems, we really use an algorithm that's unique for each patient. We look at every patient differently in terms of how is their knee worn out, what's their activity level, what are their functional demands, and where do they want to go with their knee after surgery. And then we customize our treatment approach and algorithm to that patient while employing modern technology and modern implants to get the job done. As the demand increased for our services, we recognized that there was opportunity to add more surgeons to the group and potentially fill a void where there was a subspecialty aspect of orthopedics missing within the group, and we've certainly been able to do that over the last 5 years.
Good. Good. Super. And go all the way up again. Perfect. I did a fellowship in sports medicine in Los Angeles. We dealt with a lot of professional athletes, teams, agents. I deal with any kind of sports injuries, generalized fracture care as well. Specifically dealing with shoulder and knee injuries, we do a lot of arthroscopic rotator cuff repairs, labor repairs. Very involved in designing and teaching around the country, designing implants, teaching surgeons how to use these products, and really focusing on the minimally invasive anatomic restoration techniques. One of the most common things we see are rotator cuff tears. The technique that we use to repair the rotator cuff is going to become the standard of care, I'm guessing, within the next few years. And our goal is to restore the anatomic footprint of the rotator cuff. There are a lot of different techniques to repair the tendon back down to the bone, and through the research that has been done and the latest arthroscopic techniques that we have, we feel that this is the best, most secure, and most anatomic way to repair this tendon. We do this arthroscopically through 4 small incisions, and our results have been fantastic. So we're constantly trying to come up with better techniques and better treatment options for our patients. And we're involved in a lot of design with different companies, designing shoulder implants, designing new techniques to solve a lot of the most common injuries that we see. I like to deal with patients really on a personal level. With a lot of the sports injuries, shoulder injuries, knee injuries, a lot of the rehab can vary depending on what our goal is. So if we don't know a patient personally, it can be very difficult. We all need to be on the same page. And I think that getting to know someone on a personal level, getting to know what their goals are, we can combine a rehab program, operative or non-operative program, to get them back and achieve those goals.
Outstanding. All right, my man. Thank you, Doc.
Good to see you.
You too. Thank you. I had my other meniscus and my other knee done about 4 years ago at another orthopedic surgeon, and to be honest with you, I think this one's gone a lot smoother, although it was a worse tear. I'm not really having the pain that I had. They have been very thorough. They've been, very professional, very personable, and very responsive. Anytime I've needed anything, I can call the office, and they take care of it immediately.
What I like to focus on is doing the least amount of intervention for the greatest benefit. So although we may find more than one diagnosis when we examine you, I'm going to focus on your primary pain generator. That's kind of a key phrase that we like to use because often people have arthritis and normal age-related changes that don't require treatment. We want to focus on what's hurting you. One of my areas of interest involves motion preservation. There are distinct problems in the spine that fusion is required for. But there are also other conditions that it can perhaps be avoided. And so when we think about motion preservation and new technology, over the last decade, a number of different companies have developed a disc replacement. Now this is a standard fusion, and this is a fusion over 2 disc spaces. And as you can imagine, the plate sticks away from the body and could present a little bit of a lump in your throat. The advantage of having a disc replacement is that depending on which device you use, instead of fusing, instead of attaching one vertebra to the other, you can put a device where the disc was and allow it to freely move. We think the principle of it is very beneficial to patients because just as a philosophy, you feel you can move right away, as opposed to patients that have fusion, they feel they need to stay rigid, and so their rehabilitation on a concept level from individual patients is slower. It is not as common for people to consider a disc replacement. I was part of the original study and assisted on one of the first cervical disc replacements in Colorado, and so I've had a long view of this type of technique, and I've embraced the technology, and so it's something that I can offer that you might not always have access to in other parts of the state.
So after 2 years of teaching, I decided, I'm going to go into private practice and be able to control what I do. I feel like I get to teach more and pass on the things that I want to pass on a lot more. And that's my passion, to be able to pass on what I know and what I've learned and share the enthusiasm that I have for orthopedic surgery and hand surgery to future doctors and surgeons. My area of research and interest is elbow, forearm, wrist, and hands. And I just find the whole mechanical dynamics of the hand to be very fascinating. I think a lot of people view the hand as a black box and they don't know how it works. And someone's black box is my area of interest. Over the years, however, there are some hand surgeries that are fairly painful. Anyone that's had a splinter or a paper cut knows that even something minor and simple like that can be very painful and can be a nuisance. So if you could imagine having a big laceration or even a surgical incision on your hand in these tender areas, it can prolong the recovery period. So about 10, 12 years ago, I started looking for other ways to do things to have it be less painful. And one of the great findings that I found along the way was that I started doing surgeries endoscopically for carpal tunnel syndrome, and found that I do the surgery on the Friday. Patients are able to go back on Monday with just some minor discomfort, and that has changed the way I view carpal tunnel and how patients view it. No one's afraid of it anymore after they find out how it can be done.
Thanks, guys.
I first started working with Peak Orthopedics in the operating room as an anesthesiologist in 2010. And I literally had the opportunity to watch them do hundreds of anterior hip replacements. It's an approach I had never seen before in previous work with orthopedic surgeons. So in 2011, I had left hip pain that was diagnosed as chronic degenerative arthritis, and it was severe. Dr. Laux and I were talking over the x-rays, and he took one look at my x-ray and said, "It's time. You really need this." Well, as an anesthesiologist on a daily basis, I render people unconscious for this procedure, and to realize that I was going to be unconscious while all these amazing things were done was really remarkable, to put it on the shoe on the other foot. So my surgery was on Thursday morning, and I was released from the hospital on Saturday afternoon. And the next morning at home, I was feeling pretty good, and I thought it'd be interesting to document how well I'm doing. So I gave my iPhone to my wife, and in our neighborhood across the street, and I thought she wasn't filming yet, so I was brushing some leaves out of the way of off the sidewalk, and turned around and started walking, at which point I thought she was going to start filming. Well, she captured the part where I was standing on one leg and sweeping with the other leg to get the leaves off the sidewalk, and I did that without consciously being aware that it might have been difficult to do, and it wasn't difficult to do. I was walking with a slight limp at that point, 72 hours after surgery. I joined Dr. Greenhow and Dr. Laux in Aspen for a ski trip in mid-January, and no, it was early February, and was able to spend the day telemark skiing. That's my preferred method of coming down the hill, and it does entail a little more bending and dipping because of the nature of the turning, and I felt perfectly comfortable turning in both directions and resuming my usual high-speed descent.
So I'm delivering mail, and I see another patient of Dr. Laux who had a hip replacement. She was standing 7 days out of surgery at her kitchen window doing dishes. I went up and I knocked on the door and I said, "What are you doing? What are you doing? You shouldn't be doing that." She goes, "Oh, I'm fine." I said, "What is the name of your doctor, and does he do knees?" And she said yes. I just thought it was the coolest thing because they CAT scanned my leg, and it was basically a custom built knee. And when he put it in, and the fact that it was minimally invasive, I liked that. The fact that they weren't going to cut my muscles, because I have the type of job where I needed to get back as soon as I could and needed to be in pretty good shape to do it. So I had the surgery. I went to Skyridge Medical Center. They put it in, and I was out in a few days, and literally back to work in 6 weeks, carrying mail. I can kneel on my knee, which I know a lot of, I have full, over 130 degrees, I believe, of motion in my knee. So I have no problems at all as far as mobility goes. I have no pain. It was, the only thing I can say is, why did I wait so long? I was 50 when I got it done, and I'm 53 now, and they have to tell me, no, maybe skiing isn't a good idea or what, because I feel like I can do anything. I hike, I still carry my mail, I snowshoe, I do all kinds of activities and have no limits at all. So I'm really impressed with the product, for sure. And I'm really impressed with Dr. Laux and his team, because they just, took such good care of me.
Peak Orthopedics replaced both my hips, one in November, one in December, and I'm an avid golfer, and it's been killing me that I haven't been able to get out and play golf. Last time I played was last October, and went out this past weekend, and it was the first time I've picked up a club in 4 or 5 months, and the first thing that I noticed was absolutely no pain. It was just incredible to be able to swing a golf club, walk on the course, walk into the sand traps and out, although I don't tell many people that, but just to have no pain. Second of all, my swing was incredible. I was, for the first time, really hitting straight. It wasn't over here, it was straight down the fairway. I added about 10 to 15 yards to my drives, and it was, again, the no pain thing was to be able to walk to the ball and hit and not have any pain. First hole I went to was a 420-yard par 4, hit a 220-yard drive, took a 5-iron, put it about 20 yards in front of the green, took a lob wedge, put it 3 feet away from the cup, and sunk the putt for the par, and I was like, I'm done, this is great, my season is complete. So thank you, Peak Orthopedics.
I think from the very beginning we wanted to create a comprehensive group covering all the different subspecialties of orthopedics. We didn't run out and pick 5 guys right out of the gate to come together to put together our group. We started with Dr. Laux and I, and we've slowly added on additional guys, kind of hand-selected guys from the community that were well-established and well-known and busy orthopedic surgeons to come on to our group. And it's created a very good mix of personalities and surgeons and techniques, and so it's been a great fit.
The reason we came together was that we wanted to be able to provide essentially care from your head down to your toes. So we have surgeons that can address these problems, and in times which happen frequently, where say a shoulder complaint could be related to a pinched nerve in the neck or a problem in the shoulder, we're able to work together because we're in the same group with much more greater coordination between our staff and to provide you the care you want versus having you go to some other group.
So went in to see Dr. Yi, and has a terrific bedside manner. Very, as I like to call it, talks in layman's terms. So he took some x-rays, came in, immediately knew what was going on, and then explained to me that in both of my thumbs, kind of explained it as if it were a tire with tread. He said, think of a tire with tread. He said, your thumb has treads in it per se, cartilage, and he says you're about a 3 out of 4, meaning I have very little tread left in the tire, and I'm pretty much bone on bone in both thumbs. He's the first to admit that he loves to do surgeries, but didn't rush me into surgery. He said, we don't want to rush into surgery, we want to do less invasive methods. So we started with splints, neoprene splints, and actually made my hands feel worse because they were so far gone. I mean, there wasn't a lot of relief I could get. Then we did cortisone shots, and then last summer I said, coming in here every 4 or 5 weeks doesn't make sense. For some people, cortisone works, can work up to a year. For me, it wasn't great. So I said, let's do it. Let's replace the tire. It went really, really well. He removed the joint, put in some tendon that acts like cartilage. I was, casted for 4 weeks, and then it's been just minor physical therapy. And then I said, what about the left one? Can we do that? Is it too soon? He said, no, we could probably do it, and we ended up doing it December 30th, and it's been good as well. The Dr. Yi he's got a great bedside manner. You know from talking to him that he's a phenomenal surgeon. What was funny is after I had the surgery done, I met several people who I worked with, who I knew, that had also been to Dr. Yi. So it was pretty interesting from that standpoint. And then I've told him I'm his biggest testimonial because I tell everybody about him if they're having any issues. And I've had a couple friends go to him, and where doctors have told them that they didn't have there was no resolve for their situation. Went into Dr. Yi, he knew immediately what was wrong and took care of it.
So that philosophy of having almost like a patient come to your office and be able to take care of all their orthopedic needs was very important. And again, finding a group of guys that share the same philosophy about getting patients better with minimal discomfort during the recovery was a very good find for me. And
I had carpal tunnel surgery. The incision was made here, which you can see limited scarring. I had a trigger thumb release done right here, which is hardly any scarring left there at all. I was just very pleased with my surgery, especially because I'm very fashion conscious, and I just didn't want to have any scars on my hand or have it noticeable that way. But I was very pleased with my turnout. Oh, Dr. Yi is so friendly, and his bedside manner is just awesome. I mean, I would definitely refer him. In fact, I've referred several checkers to him from King Soopers because he's so personable, so friendly. His bedside manner is he's just great. I was very, very happy with Dr. Yi.
A lot of people are sometimes frightened to come to a surgical practice thinking that they're going to have surgery, whether they need it or not. And our goal really is to work with the patient and meet their goals, whether it's non-operative, whether it's operative, whatever is going to be the best and the quickest way for the patient. And I think the thing that has made us successful is that people feel comfortable coming and talking to us. They don't feel like they're talking to, what their perception of a surgeon would be. Although we're surgeons, our goal is not to operate on everybody. Our goal is to get you back to doing what you want to do. And I think that's really what we gain.
Okay, so on the 4th of July, 2008, a day that will remain in my life forever, because I was riding my bike and I tore my meniscus and my ACL in my left knee. It was 4th of July weekend, so the docs at the emergency room said, well, here's a brace and here's some crutches, so follow up with an orthopedic next week. So I called my PCP and they recommended that I see Dr. Fitzgerald at Peak Orthopedic and Spine. And I am really glad because Dr. Fitzgerald is a wonderful, skilled surgeon, and he's also a great guy, and he's really helped me through what has been a really tough 3.5 years of my life, having 6 knee surgeries. By last summer, about 6 months post-op after that, I was able to get out and play a little bit of basketball with my grandson, and that was just so much fun to be able to do again. And now that I've had the left knee done, I expect to beat him this year.
I think one of the advantages of our group is we take a very holistic but also very conservative approach. When someone comes in through the door, we don't immediately book them for a surgery. We start with very simple things such as physical therapy, anti-inflammatory medications, injections, and when all of those things have failed, then we start talking surgical options. And I think that's where we really shine as a group. We have guys who are very specialized in their training, from our spine surgeon who does everything from fusions to disc replacements, to our shoulder surgeon who uses the latest and greatest arthroscopic techniques, to our joint replacement surgeons, Dr. Laux and I, who use cutting-edge techniques, anterior approach muscle-sparing joint replacement for hips.
With the addition of Dr. Yi for our hand surgery, we really can cover all aspects of your musculoskeletal problems. So the goal of the group is to be able to function together to deal with a specific problem related to your body that may or may not be related to a spinal problem or an extremity problem, so that we don't have to have you moving from practice to practice. You can stay within one practice.